All right, I think we have a good number of people. Um, so welcome everyone. Good morning. My name is Isaias Guzman, and I'm the program coordinator for We Breathe. We Breathe is the statewide LGBTQ coordinating center for all CTCP funded projects and agencies. And for those who don't know, that's the California Tobacco Control Program that funds local projects to do tobacco control work. Today, we're going to be talking a bit about the LGBTQ policy platform. Let me try and share my screen, and then we can get started. Let's see. All right. So today, it's been a long time coming. This policy platform has been in the works for a few years now. Our project was funded in 2018, and since then, this platform has been in the works from a combination of multiple people who are LGBTQ identifying experts, allies, and so many are in the room today as well. So I just want to thank everyone who has been involved in this process. So for today, we're gonna do a little bit of terminology, defining a few terminology, and this is based on popular support. We're gonna cover a few concepts that we got feedback on that was really valuable for people. And so we're going to be defining today, before we get started, concepts of intersectionality, concepts around systems of oppression, health equity, and social determinants of health. These terms are incredibly important in being able to understand the framework of the policy platform and how it came to be, and the ways in which we're using intersectionality as a lens to do the work that we're doing. And these concepts are also really important to be able to engage LGBTQ communities, being able to address the roots of tobacco use and understand really what this platform is trying to address. After learning the basic terminology, we're going to learn really briefly, since there's a whole other webinar on this, but we're going to go over the policy platform process, just look at what types of work we did that helped inform the policy platform, and then we're just going to dive deeply into the policy platform recommendations. If you want to learn more about the research and the references for what we're going to be discussing today, you're more than welcome to get access to the report on our website and get those citations from the report. After we go through the recommendations, we'll be learning a few strategies on how your local coalition or program and project can apply the recommendations from the policy platform into your own work. And then we'll have a short questions and answer session for folks. And I think that's the plan for today. All right. So first and foremost, we'll be covering intersectionality. So again, for us to talk about LGBTQ community voices and integrating that into our work and understanding the policy platform, I want to first tackle defining this term. It's used a lot in our communities. It's used a lot in our social spaces and academia. We're using this language now in public health, and there are often a lot of definitions that exist out there, but the formal definition that we have here is the theory that various forms of discrimination centered on race, gender, class, disability, sexuality, and other forms of identity do not work independently, but interact to produce particularized forms of social oppression. As such, oppression is the result of intersecting forms of exclusionary practices. So essentially, intersectionality serves as a lens that can bring to light the unique experiences of people who share two or more marginalized identities. And when we're thinking about intersectionality in public health, this can help us think about who we may be leaving out of the conversation when we're doing our work. This helps us try to better understand in what ways can we tailor our intervention activities and our evaluation activities to capture marginalized communities or communities that are often left out of the conversation. And so a critical intersectional lens can be useful in creating an inclusive and accessible program for tobacco control initiatives and projects. These social identities can include race, class, sexuality, gender identity, sex, age, ability, ethnicity, language, immigration status, culture, and so on. And the point of showing all of these aspects of our identities is to be able to visualize that in order to fully understand one form of oppression, so that we can be able to understand all forms of oppression. So when thinking about a social identity, it can often be thought of as a standalone, discrete identity that exists independently from one another. But in reality and in the work that we do, a single identity exists in relationship with every other identity that someone can hold. So for example, one can be a Latino, a man who identifies as cisgender, straight, and is low income. So that person can experience both privilege and oppression, given that that person holds less power due to their race, ethnicity, and wealth, but he is also holding privilege due to their gender and sexuality. And so here, intersectionality is defined as a lens through which you can see where power comes and collides, where it locks and intersects. It is the acknowledgement that everyone has their own unique experiences of discrimination and privilege. And that's from Kimberly Crenshaw. Kimberly Crenshaw was the one who coined the term intersectionality. And in this visual called Wheel of Power and Privilege, you're able to visually see what types of identities hold more power than others. So once you start listing your own identities and understanding whether they hold power or not, that is called being able to understand your own positionality within the systems of power and oppression. Positionality as a term describes your location in time and space that can influence how one engages and understands the world. So it's the way in which we understand how the world is influenced and informed by our social identities that can include the knowledge you create, your values, and the biases in which everything is filtered through your own life, through the way you say, think, and do, intentionally or subconsciously. So you can use this visual as an opportunity to understand your own positionality and understand how privilege and oppression can interact in your own lives. It's important to remember that everyone holds these identities, and it can be a mixture of marginalized identities and identities with power. And this visual can be useful and helpful to amplify your own efforts to uplift the voices of marginalized people in your community, from queer and trans people of color, differently abled folks, rural communities, immigrant communities, low-income people, and so forth. So don't be afraid to try something new in order to help your communities become more inclusive and equitable by using these types of tools in your work. So another visual to help understand these concepts is the language of oppression. Often we might mix these concepts up, but to help better flesh out the difference between stereotype and prejudice versus discrimination and oppression, we can see here that when we talk about stereotyping people and having prejudice against different types of groups, these are often informed by thoughts and feelings and beliefs that are internal. And when we're having those types of thoughts and beliefs, that would be considered intrapersonal. Once those thoughts and beliefs translate into behaviors and actions that are impacting other people, that is considered an interpersonal behavior that can be categorized as discriminatory and is a form of discrimination. And then when those types of behaviors coalesce with other people who might be sharing these ideas and beliefs and are engaging in those behaviors as well, and making those beliefs and behaviors into policies and codifying that work, that's when we're talking about oppression. And when we talk about systems of oppression, we're talking about systems in which there are procedures and policies and practices that is informed by culture and laws and values that are creating creating barriers for communities to achieve equity, and in the work that we're doing, health equity specifically. And so I like to include Audre Lorde's quote, "There's no such thing as a single issue struggle because we do not live single issue lives." And for today, we're also defining allyship, since a lot of folks might not, may be here to learn more about LGBTQ communities, and so you might identify as your ally, and we all need allies in our work. And I myself as an ally to other communities who I don't share a marginalized identity with, right? So that makes me an ally to multiple communities. So we all can be allies, even if we are LGBTQ identifying. Here we're defining an ally as someone from the non-target group or different target group who will stand in the way of oppression when it is aimed at a target person. It is someone who will question and resist the institutionalized oppression as best they can. Tactics that include the tactics of allies to increase inclusivity can involve listening and learning from those marginalized communities, taking action on that knowledge and education, using your privilege, supporting the marginalized person's leadership, taking a chance and making mistakes, and of course, taking care of yourself, being able to get support and accepting support, trying to dismantle, these structures and systems that exist to marginalized people can be very exhausting, whether you're an ally or part of the marginalized groups. So, this work requires solidarity and across marginalized groups and across people. And so it's always important to make sure that you're taking care of yourself because self-care is important. So now that we understand intersectionality and systems of power and privilege, today we'll also be talking a lot about health equity, right? The way we define health equity, the way we identify health equity is by addressing structural and systemic barriers that create health disparities and limit accessibility to healthcare, employment, education, housing, and more. So we know that when we're doing health equity work, what we're talking about is getting to the root causes of what is creating these health disparities. Why are our communities smoking more? Why are communities have higher rates of suicide and depression? Why our communities have higher, engaging in substance use at higher rates? And so another term that is important in the work that we do is the social determinants of health. This describes the economic, environmental, and social conditions that affect a wide range of health, functioning, and quality of life outcomes and risks. So when we're thinking about the social determinants of tobacco use, we're also thinking about, the types of the environment, the type of healthcare access, the quality of education, the economic stability of our communities, and so forth. So we're thinking about how all of these different indicators are influencing our communities to be using tobacco use. And of course, another great Audre Lorde quote is, without community, there is no liberation. So again, it's really important to think about this work as work that we're doing in solidarity with one another, as an ally or as the marginalized group. We'll always be, in a position where we hold power and it's always important to be able to engage in solidarity work and allyship. So with that being said, we can get started with the policy platform. So today, when we're thinking about developing the policy platform, we knew we wanted to center LGBT communities in the process, but there were many challenges and barriers to get the data we needed in order to provide tobacco-related policies. So first, we're going to go over briefly what a policy platform is and the policy development process. So the purpose of the California Tobacco Control CTCP recommending policy platforms for statewide quarantine centers is for us to design a list of recommendations for jurisdictions to help them guide what specific policies work for each priority population. And so this can include priority populations from the LGBTQ community, from the African American Black community, from the Hispanic Latino community. And so for us, we focused our policy platform on how we can address the root causes of tobacco use among LGBT communities, and made sure that not only was the policy platform evidence-based, but also community informed. So we got tobacco control experts and community stakeholders to participate and engage in the development of the policy platform. So in this development, we conducted key informant interviews with LGBTQ and tobacco researchers. We listened to members of the LGBT community through press conferences, through affirmative town halls, listening sessions. We engaged with LGBTQ resource centers to subcontractors. We conducted a public intercept survey, and we presented these findings to LGBTQ tobacco control experts and advocates, and we worked together to identify systemic and environmental and policy recommendations. We also conducted 2 gallery walk sessions to gain feedback from the community and from advocates. And after the 2 gallery walk sessions, we used the information we gathered from the key informant interviews, from the listening sessions, from the gallery walk activities, and other areas where we got feedback from our communities to inform the creation of the policy platform. So we wanted to make sure that the policy recommendations were backed up by research, working with LGBTQ tobacco control advocates, and was supported by the community. We were trying to make sure that we wanted to prevent the possibility that our recommendations might negatively impact the communities we are trying to serve, which are LGBTQ people. And so getting community engagement and feedback for the work, for the policies that we came up with, was vital to the creation of this platform. So when I ask, well, why create this lengthy process? Well, there's a systemic and institutional barriers that limit our ability to look at tobacco control policy specifically and their relationship to LGBTQ plus communities. The data does not exist for us to answer specifically how tobacco control policies impact LGBTQ communities. So there are various systemic and institutional barriers. We know that right now, there's a lack of standardization and enforcement of SOGI data collection. Different agencies and different departments do not have a standardized approach in collecting demographic data when it comes to LGBTQ people. We know that there are barriers to competent care. Our communities, one of the feedback that we would get often throughout this process is that there's just barriers to competent care. How can we get to cessation programs or other forms of healthcare services for our communities when these service providers are not culturally competent to provide these services? There are issues with with violence, discrimination, and harassment with our communities that are more salient on top of that are more salient than talking about tobacco use. There are issues of not getting harassed or become a victim of a hate crime. There are other issues that are impacting our communities that sometimes tobacco use is used as a coping mechanism to be able to manage and try to survive through these types of forms of oppression. And so that's number 3. There's the different types of social determinants of health, and minority stress is something that I did not define, but I can right now. Minority stress describes how external stressors such as discrimination and internal stressors like internalized homophobia or transphobia can increase stress and deteriorate health. And so minority stress is important in these conversations. So like when we're talking about challenges to the development policy platform, we engaged in a comprehensive literature review, and we learned that no research institution or tobacco-related disease research project have conducted research on how policies such as outdoor dining bans or flavored tobacco bans or multi-unit housing bans have impacted LGBTQ tobacco use. And we saw that no research has been done to review how such bans may positively or negatively and unintentionally harm LGBTQ communities. We don't know how effective cessation interventions that exist now, how it impacts LGBT community. There's no research that disaggregates the data to be able to understand how these cessation programs impact different subgroups of the LGBT community. When we think about, when we talk about LGBTQ plus communities, when we talk about LGBTQ communities, we're talking about lesbian, gay, bisexual, transgender, queer. There's multiple groups of people in the LGBTQ plus umbrella. And so when we're saying, the collection of demographic data, we're also talking about being able to disaggregate data from that in itself and be able to compare health disparities between our own communities, between folks who identify as bisexual or lesbian, between people who are cisgender versus transgender, people who are Latinx and gay versus Latinx and lesbian. Like there are multiple ways in which there are barriers to getting the information that we need. And so because of this, there's also barriers to competent care. There's a lack of culturally competent healthcare providers, including mental health. Right here, we have some examples of community members describing their own difficulties in finding culturally competent care. Right here, we have an LA County community member talking about the difficulty to find a therapist who are LGBTQ affirming, who are culturally competent. They go on to say that when we say culturally competent, we just don't mean language. It's also about understanding the background, the heritage, and all the intersections and complications that come with their identity and how that impacts your mental health. Right here, we can see how a form of social determinant of health, another community member describing experiencing racism, which impacts their mental health, which we can see, again, if we're thinking about intersectionality as a lens, we can see that these are different forms of minority stressors that can lead our communities to engage in tobacco use. And so they're talking about depression, anxiety, and the other layers that come with mental health. And so this is another example of a Shasta County community member talking about lacking of basic safety. this says, for example, I went to the post office in the middle of the day, happened to be wearing a shirt about pride, and ended up with somebody yelling at me about how I was going to hell. To me, I'm just trying to go to the post office. And so these examples are these are included here to reflect the types of experiences LGBT people are experiencing, that they're living in their daily lives and thinking about, and what they're prioritizing in when we're thinking about what are the, what are the salient issues that are impacting our communities, what are the things that we need to focus on. And this is the type of experiences our communities are living through. And when we want to address tobacco use, we need to find a way to think about how tobacco use can be connected to these issues to make tobacco salient and important, and be brought up as a hot topic for our communities. So without further ado, these are the policy platform recommendations. They have been divided into 5 categories to help organize and structure the conversations. But in reality, the recommendations all intersect. Issues that are related to, let's say, funding recommendations are connected to the systemic and environmental changes, and issues labeled as cultural sensitivity can also be categorized as guidance from the LGBTQ community. It's important to remember that the work connects with one another because issues interact and intersect with each other. And so one of the recommendations that we have is SOGI data. One of the things that we notice is the fact that there's no standardization around how we collect this information, and so we want folks to mandate SOGI questions into tobacco control data collection efforts, and there should be an organization or agency that can provide technical assistance for that type of implementation. We know that because there's no standardization, and because some organizations or agencies are not collecting SOGI data to begin with, even though it's required by law, our communities have been rendered invisible by the fact that the research that exists right now does not include sexual orientation or gender identity. This makes it really difficult for us to even capture the realities that our communities are experiencing. It's really difficult to go to funders or to go to city council or talk to other decision makers and tell them, hey, these are what our community's needs are. This is why we're trying to pass these important policies, when the research is not there. We are often relegated to quotes and excerpts and qualitative information, because when we're trying to capture quantitative data, our partners and people who conduct that type of research are just not doing it. And so these are forms of systemic and institutional barriers that are really just the first step to trying to do the work that we need. Research and survey funding agencies can easily fix this issue by making SOGI questions mandatory. As a condition of receiving funding, our projects should be required to include LGBTQ plus subject matter experts in the collection, analysis, and reporting of SOGI demographic data to make sure cultural sensitivity, data accuracy, and current best practices are being utilized. Historically, we've known that LGBTQ people and our communities have been disproportionately victims of violence and crime. But this is an example of the National Crime Victimization Survey. In 2016, they began documenting sexual orientation and gender identity. And the public data was released for the first time in 2019. And in that report, we found out that, of course, LGBTQ communities are disproportionately victims across a variety of hate crimes. We know that LGBTQ people age 16 plus are nearly 4 times more likely to experience violent victimization compared to non-LGBTQ plus people. LGBT women are 5 times more likely than straight cisgender women to experience violent victimization. And the risk of violence for LGBT men is more than twice that of straight and cisgender men. So this type of SOGI data collection has been helping us better understand and capture the different types of experiences, particularized experiences from different subgroups of our communities. And so this is another quote. "We don't know which interventions work for which subgroups of the LGBTQ communities. I'm not aware of any bisexual culturally targeted intervention for bisexual smokers or other tobacco product users." So there hasn't been research done to explore the relationship between tobacco use and other social determinants of health, such as access to healthcare, discrimination, adverse childhood experiences, and more. And so we know that if we're able to standardize and mandate SOGI data questions and demographic collection efforts, we can start addressing these concerns. And so here's another quote. That level of sophistication of looking at the intersections of something like housing insecurity with being a sexual and gender minority or a person of color and smoking, it isn't just there. So if we're able to collect SOGI data at the state, at the federal and local levels, we can start capturing those different rates of disparities among LGBTQ plus people. We can compare them to cisgender and heterosexual people, and we can start to see the unique and common ways in which our communities experience inequities. And on top of another recommendation from the policy platform includes being able to fund LGBTQ technical assistance providers to be able to serve all CTCP projects with SOGI data collection and other needs. And when we're talking about funding, we're talking about RFAs, specific RFAs to fund an individual contractor or organization to provide guidance and support to CCP funded projects and help them understand how best to design the SOGI questions in their surveys and how to ask them and how to collect that data and how to process it. So there has to be specific RFAs for this work. And so when we're talking about collecting SOGI data, this can be coming from public opinion polls, from tobacco use surveys, from key informant interviews. There are multiple evaluation activities that tobacco control coalitions and projects are engaged in which this would be incredibly important for a technical assistant provider to be giving that support to these to our agencies. So another policy recommendation are focused on LGBTQ plus research needs, things that we need from the research being done about our communities and sometimes not involving our communities in that research. Research should be research that's funded and that's exploring LGBTQ people should use intersectionality as a lens to understand how tobacco policies and legislation impact LGBTQ plus people. Again, this includes differences within LGBTQ subgroups, and that can include the intersectionality of LGBT communities in tobacco and those who are unhoused, those who are struggling with food security, those that are unemployed, and those who are experiencing barriers to healthcare. And so forth. And in order to be able to increase representation, we need to make sure that the research that is being funded are including LGBTQ voices. That the principal investigator doing this research is LGBTQ identified and is working in collaboration with LGBTQ organizations and community centers. This will help us make sure that the work is being is culturally sensitive, it's equitable, and it's culturally defined. Funding institutions can support this by funding community-based participatory research. and require all research to include LGBTQ researchers and LGBTQ partnerships. And another recommendation is related to LGBTQ funding to organizations, specifically recommending for a recommendation to fund LGBTQ centers, and that includes BIPOC-led LGBTQ organization, that is Black, Indigenous, people of color led. Being able to fund LGBTQ serving organizations to provide support groups where members of LGBT communities can be able to make positive connections will improve our not only our mental health, but our physical health, and reduce rates of tobacco use. Earlier, we discussed the high rates of violence and crime experienced by LGBTQ people, and especially transgender communities. And while collecting social data is useful, it can even be more effective if it's collected by our partners, by the community. We know that many transgender people do not feel comfortable or safe, reporting crime to the police. We know that other LGBTQ community, other subgroups of our LGBTQ community do not want to engage with these different agencies. And so we know that if we're able to fund LGBTQ plus centers, if we're able to support these spaces that are safe for our communities, we can increase not only reports of harassment, but create safe spaces for different types of programs and services. When it comes to accessing healthcare programs, when it comes to housing or homelessness and going to a homeless shelter, there are often barriers to getting that type of assistance. There are fears of being outed. There are fears that those types of programs and services are discriminatory, that the service providers are not culturally competent. There's low levels of confidence, and so being able to fund LGBT centers can help in that process. So here's another example. We know that this is from an LGBTQ service provider. When we tried to refer trans women to a shelter, they ended up leaving the shelter because they're being misgendered and harassed. Studies suggest that LGBTQ plus survivors have low confidence in healthcare providers' ability to help. We know that some transgender people have reported that their healthcare providers lack competency on transgender issues, and that's why transgender people may have particular difficulty seeking help from healthcare providers and so forth. And so here's another quote from a Shasta County community member. I would love to see Black and Indigenous people of color safe spaces. There are days that I'm weathered more than others. I need to be around other BIPOC individuals that get the microaggression that I experience on a day-to-day basis, whether that's being queer or being an individual of color. Research has shown that LGBTQ people in California are seeing a lack of funding for LGBTQ serving organizations that provide programming and social services for LGBT communities, and especially for Black, Indigenous, and transgender people. Across California, LGBTQ people shared having experienced some form of anti-LGBTQ harassment or discrimination, which can lead to feeling unsafe in accessing support groups and mental and physical health services. We know that there are multiple challenges and barriers facing LGBTQ people who are trying to receive care. We know that LGBTQ centers are one of the safest places where LGBTQ people can receive healthcare programming, including cessation services, and receiving comprehensive mental health support as they quit tobacco use. So this includes funding LGBTQ centers, mental health programs, and support groups. There are various barriers in finding culturally competent therapists. Most of our communities are seeking therapists who share their identities And so when we're thinking about, LGBTQ folks, they're looking for therapists who also identify as LGBTQ to have a shared understanding of their lived experiences. And so when we're thinking about LGBTQ people who are transgender, Black, or Indigenous, when we're looking for therapists who may share those identities, that's very rare and far in between. And so in that case, there's a lack of sufficient therapists and culturally competent therapists, which acts as a barrier to mental health. We know that the cost to access mental health services serve as a second barrier to getting care. And most, if not all, the existing therapists who can meet those criteria of being part of the community are already at capacity. And in order to be seen by one of those therapists, there are long wait times and can often be unaffordable. So it's important to be able to find providers who are able to be accepted by a person's health insurance. There have to be meeting these criteria of sharing these identities and making sure that these therapists are accessible, are available in their cities and or counties. And so when we're thinking about why it's important to be able to fund LGBT community centers, we're also thinking about what different types of healthcare services and programs can LGBTQ centers offer to make it easier for our communities to access, to ensure that they're receiving culturally competent and care in a safe place where they can go from not only mental health, but physical health. And that can include cessation programming and services in that process. And so we know that the presence of depressive and suicidal symptoms is strongly related to currently smoking and studies that have been conducted with LGBTQ people. And so that's another reason why funding LGBTQ centers are an important way to tobacco control and tobacco prevention. LGBTQ centers can provide comprehensive mental health care. They can provide tobacco education workshops. That's where communities can have an opportunity to learn how tobacco impacts health as an LGBTQ individual. That's where, in these workshops and presentations and trainings, people can learn about the history of tobacco. They can learn about the pervasive marketing tactics of big commercial tobacco companies exploiting our communities. In these LGBTQ centers, we can address the issues of implementing, tobacco-free prides and smoke-free LGBTQ bars, and be able to implement LGBTQ tailored tobacco control policies with the partnership of community centers. They're also a great place to tailor messaging for our tobacco control projects. So the LGBTQ community centers are a great place to be able to incorporate LGBTQ messaging. And so when we're thinking about messaging, we're also thinking about adapting culturally relevant language and images that are tailored to LGBTQ communities. That is messaging that is focused on what matters to us without shaming or stigmatizing our communities. This can include promoting, self-care and mental health awareness as a framework to stop quitting, which is 3 here. Or we can also think about quitting as a family with friends, or to create a healthy environment for the ones that you love, whether it's blood family or chosen family, or it's the pets that you have, your dogs and your cats, using sex positive messaging that include quirky LGBTQisms, like put something else in your mouth. And so, all of these types of messaging are ways that LGBTQ community centers can adapt and engage in. Saving money that might not resonate with our communities. It's not something that we're focused on. And so these are examples of what that can look like. And so the need for funding from LGBTQ plus community-based organizations exists, and it's there. Here's, in this quote, we can see someone from the Alameda County community, an Alameda County community member say, they don't really talk about queer people. Recently, there was a substance abuse grant, and no LGBTQ plus organization was funded for this particular substance abuse grant. And that speaks volumes to me, how these governments are thinking about our community. We know that that desire to apply and seek funding from state governments and local governments and county governments is there. But again, there are barriers for accessing these types of funding. So in addition to funding LGBTQ community-based organizations, we're also recommending establishing a network of LGBTQ nonprofit organizations who are funded to provide these services and programs that are culturally competent and include tobacco education. So in addition to being able to fund these organizations, after them getting funded, creating a network and providing a sort of a list or a website where you can just go to that page and see all of the list of organizations who are providing these culturally competent services, where communities from across California can access and find the closest resource center for them. That's the idea behind this recommendation. Another recommendation is funding the Latch Drag Intervention Program. Cessation, we talked about cessation programming and services to be included at local LGBTQ resource centers. And that extends to the Latch Drag program, which was historically a cessation program that was specifically for LGBTQ communities. And in addition to not only just the Latch Drag program, we're also recommending mobile lung screenings at LGBT centers. This is a way, again, to reach our communities, to be able to incorporate community organizations to tobacco control. Another recommendation is launching a network of LGBTQ culturally competent mental health providers. This is another recommendation that came up, given that access to mental health care and culturally competent care, as we recently discussed, is incredibly difficult. And being able to have access to people who are able to provide these services can help folks connect them to tobacco cessation programming and services, and be able to increase our to remove barriers to access to care, improve our health and wellness, and our ability to get the healthcare that our communities need. And so here's another quote: "You cannot implement programs and policies without a good partnership, a trusted partnership with the LGBTQ gatekeepers, which are usually the centers." And I think that is really is untapped. And so this is a great example of how and why LGBT community centers are a great place to start integrating tobacco control programming and finding innovative partnerships between LGBTQ communities and tobacco control. And so the next category of recommendations are, related to cultural sensitivity and humility. In our policy recommendation, one of our policy recommendations include implementing LGBTQ plus cultural humility trainings for all California tobacco control programs that are, CCCP funded projects. These trainings should be conducted by LGBTQ serving organizations and should include recruitment of community members onto community advisory boards and compensation provided for their time. We know how important it is for projects and coalitions to increase diversity and representation. And I think, again, there should be RFA specifically to address this concern, where we want to make sure that not only are coalitions and projects and agencies equipped to collect SOGI data collection, but they're also equipped to recruit and engage LGBTQ plus community members, and specifically how to make the programs, the tobacco control programs, more inclusive to LGBTQ people, to make sure that each funded project are engaging, are inclusive and equitable, and are engaging with LGBTQ communities and culturally sensitive ways. And so that goes on to their next recommendation, which involves creating an RFA for an LGBTQ plus technical assistance provider to serve all CTCP projects, locally agencies, statewide agencies, and grantees with their SOGI data collection, LGBTQ plus inclusion and training needs. That is a given, right? We want to make sure that there's funding for someone who can provide that support with SOGI data collection, who can provide support with LGBTQ inclusion and trainings and so forth. And so on our next list of policy recommendations are related to systemic environmental changes. One of our recommendations include the collaboration between programs and departments within the California Department of Public Health to be able to address health inequities of LGBTQ plus communities. And so going back to the lack of standardization of SOGI data collection, this recommendation is focused on making sure that the different departments are communicating with one another, are being able to work together to standardize not only SOGI data collection, but other programming to ensure that there's consistency among LGBTQ services and programs for our communities. We know that collaboration between departments can assist in addressing the health inequities experienced by the LGBTQ plus communities. This includes addressing social determinants of health, such as food insecurity, lack of housing, etc., and how these challenges may increase tobacco usage. And so one of our other systemic environmental recommendations involves streamlining sexual orientation and gender identity data collection within the California Department of Public Health and the Tobacco Research TRDRP to close gaps in data for the LGBTQ community. And our next recommendation is to collaborate with the California Department of Education to include LGBTQ plus tobacco learning modules in secondary school health curriculum, such as including cessation services in secondary school health classes and integrating LGBTQ education and tobacco work. Another recommendation is funding GSAs and support staff, being able to include LGBTQ youth specific quitline or allow counselors and school psychologists to assist in cessation services while providing a referral to a local LGBTQ center that is able to offer mental health services. When we were thinking about outreaching to LGBTQ youth, we need to know, the spaces in which LGBTQ youth are engaged in, and we know that GSAs are often the safe spaces where people come together. And so working with GSAs in schools when we're thinking about tobacco use prevention in higher education, in secondary schools, we need to think about GSAs as a vital partner and those efforts. We know that tobacco use is the most preventable health crisis facing LGBTQ plus youth. Due to the lack of access to supportive services, bullying, isolation, and lack of connectedness, we know that 40% of LGBT high school students actively use at least one type of tobacco product, a rate that is higher among heterosexual students. We know that across school levels, transgender students are more than twice as likely as their non-transgender peers to indicate that they had experienced bullying or harassment and were in fear of physical violence. Which leads to another quote. This one says, "We need more visibility for LGBTQ people in schools. Schools aren't buying LGBTQ inclusive textbooks, so teachers have to decide to incorporate LGBTQ information. There's no training or support for LGBTQ inclusion." And so, in the work that we're doing, we're seeing that being able to partner with LGBTQ organizations, with being able to partner with GSA organizations when we're doing work in schools, and being able to include tobacco education in physical health classes, and making sure that those sexual health education includes LGBTQ communities is a way to tap into addressing these disparities among LGBTQ youth. We know that another policy recommendation is supporting minimum retail prices to consumers. We know that there are data that suggests that higher income folks smoke less, and so minimum retail prices ensures that it increases the cost of tobacco and can counter the targeting of big commercial tobacco companies exploiting low-income LGBTQ plus communities and communities that are experiencing homelessness, unemployment, and so forth. And our next policy recommendations are focused on guidance, some guidance from the LGBTQ communities. So one of our policy recommendations is to keep police out of public health. We want to make sure that it is instrumental that funders, coalitions, and local lead agencies are not forcing or withholding funding from LGBTQ plus projects and or community members, and forced collaboration with policing systems that have historically oppressed and targeted queer communities of color. We do not want people being criminalized. We want the focus to be on retailers for not following the law. We want to make sure that our coalitions and community members are able to engage in tobacco control and not be prevented from participating because there are police presence and law enforcement. And if that's the case, then our projects should be able to continue to engage in tobacco control without having to be forced to collaborate with institutions that have historically and disproportionately targeted and discriminated against our communities. And with that being said, another recommendation is to take policing out of schools. Police should not provide prevention work in schools, but instead should be focused on making sure that the enforcement is focused on retailers and tobacco retail licensing. Again, the penalty should be focused on the retailers not following the law and not criminalizing people using tobacco, or criminalizing individuals either in schools or working in tobacco control programs. And so another recommendation is to create alternative suspension programs. such as an education learning model, youth services that collaborate with mentorship, senior services, or they create funding for LGBTQ plus elders to share their stories online that is easily accessible for students who need a sense of belonging. There are different ways that we can focus on restorative justice approaches rather than punitive policies that often are used in, discriminatory against, trans and gender nonconforming folks for not following, dress code or uniforms, etc. And so we know that punitive policies are not the best, and so it's better to focus on positive learning models and mentorship programs. So making cessation products accessible is another policy recommendation. LGBTQ people need 100% insurance coverage for cessation products, with the understanding that cessation products aren't a one-size-fits-all. If coverage for cessation products isn't 100%, that in itself is a barrier to care and to encourage our communities to stop smoking. It is already difficult enough to prioritize this as a community priority, but also to be able to not only say, hey, tobacco is important in LGBTQ communities, but you're not going to have to pay for that if you want to quit. It's just not going, it's not effective. It's not an effective strategy to combat the high rates of tobacco use. And again, another positive recommendation is supporting collaborations between cessation service providers and LGBTQ plus focused agencies. We talked about the importance of LGBTQ community centers and trusted partners. If there are cessation programs, it's important to make sure that they're partnering with these community-based organizations to be able to engage with our communities and make sure that that they are working with trusted partners and are able to provide culturally sensitive and competent care. So this can include referring community members to medical providers who will provide a prescription for a cessation product. And we can look at HIV and STI collaborations as an example. And as previously mentioned, this can include mobile lung units for lung screenings at LGBTQ plus centers. And so how can we, when we're thinking about all of these policy recommendations, how can we integrate these big, lofty and hefty goals that have been outlined? How can we think about translating these systemic policy ideas into local work that we're doing in our tobacco control projects? Well, there are simple steps that we can take as individuals. We can start creating inclusive spaces for our communities. We can start creating programming that is inclusive to LGBTQ people. One way is by using pronouns. We can use pronouns during coalition meetings, integrating name tags with pronouns at conferences. We can use pronouns when public speaking, being able to start normalizing the pronouns used either in our work, including adding pronouns in our email signatures and so forth, starts to normalize this practice that creates a safer space for our trans communities. We know that we all have pronouns, and being able to normalize that will be a step in the right direction. We know that celebrating LGBTQ events and awareness days and advocacy days into your tobacco control work, there are multiple ways to bring pride, for example, into tailoring your own messaging in your local communities. And if you need help with that, WeBreathe can provide support on finding ways to tailor that messaging and materials for LGBTQ people. Creating an inclusive workplace, adding LGBTQ plus pins and stickers and other imagery to show yourself as an ally is a way to support LGBTQ plus communities. Creating whether you're creating these safer workplaces, whether you're providing direct services or co-workers, being able to include this imagery is often seen as very positive by our communities, especially if you're working with youth. This can be a sign of safety, that you're going to be supportive to them. And so this is a really great way to show allyship and solidarity. And it's also a small gesture of support to LGBTQ people. And we also talked about previously, but I'm bringing it up again, collecting demographic data. That's so important. Being able to collect LGBTQ demographic data in the work that you're doing when you're conducting public intercept surveys or public opinion polls, when you're collecting key informant interviews, whenever you're talking about race or ethnicity or gender, when you're asking about zip codes or money, when you're asking about any information of a person, there should be conversations about sexual orientation or gender identity. And if that's not happening, I would encourage you to work with TCEC to find to get support to include SOGI data questions in your work. And so we've talked about why is it important to collect this information. It's important because we know that this is going to capture the information that we need. It's already required by law. It's required by law since 2015 by AB 959, where 4 departments within the Health and Human Services agencies are required to collect this data since July 1st, 2018. We know it helps address health disparities. We know that being able to provide standardization to SOGI data collection will be able to better understand the health of LGBTQ Californians. We know that it can help understand risk factors, tailor policies and treatment protocols, tailor cessation services and programs, and improve health outcomes. It affirms LGBTQ people. It's part of who we are, that is often left invisible. And I think most importantly, something that I've heard from some partners is this fear around asking SOGI asking SOGI questions when doing surveys. And our experience has been that there are no concerns when actually collecting this data. We've seen that people are not reacting negatively when being asked these questions. If you're conducting surveys and you're asking these questions, you can always let the people answer themselves. You can give them either the tablet or the pen and papers for them to fill out if they want some privacy. But there's always a choice in when asking SOGI questions of saying prefer not to answer. And so if there are fears or concerns around implementing SOGI data into your work, you're always more than welcome to contact us as well, or TCEC, and find ways to address those concerns. But I can tell you right now that people are more comfortable talking about their income than they are talking about their sexual orientation or gender identity. And again, asking these questions are going to be important in our ability to understand the issues that are faced by our communities. All right, so any questions? There's going to be the question and answer session for folks. Pashi, is that you?
Wait, what is, yeah, I just actually, Isaias, you did a wonderful job as someone who worked many hours on this. I just want to say, I think I heard you say that people were more comfortable sharing their income than their sexual orientation or gender identity. And I think you meant it the other way around. People are actually less comfortable talking about how much money they make than answering questions about sexual orientation. So if we're really worried about what people are uncomfortable answering, stop asking them how much money they make, which we constantly do. So, but thank you so much. I don't have any questions. I just wanted to make sure we got that reversed. Thank you, Isaias.
Thank you. Yes, that's what I meant. People are less comfortable talking about their income than they are talking about sexual orientation, gender identity. All right, well, do not go away because there's still one more thing left to do, and that's providing us with feedback. And it's not just going to be questions around like how great it was or how, you know, things that need to be improved. There's a question included that's asked that asks about whether you want to learn more about the policy platform, and if so, what exactly do you want to learn more about? And that's going to help me tailor future webinars on what you're actually trying to learn more. And if I get that information, I can create our the next webinar, the next subsequent webinars on those topics and issues, and focus on that, on what you want to learn more about. And so, yeah, so please take the survey. The link can be provided in the chat. Adela, if you can share the survey link in the chat before we close. All right, so thank you everyone for being here. And if there are no questions, we can end the training a little early. All right, okay, so since there are no questions so far, thank you so much, everybody. Again, if there are any concerns. Oh, okay, give me a second. I think we do have a question. So I'm going to read this out loud. If it's a question. Oh, no, it's a resource. Okay, great. So it's resources. All right. Thank you, Brittany, for sharing that. All right. Well, without further ado, thank you, everybody. And I hope you have a wonderful weekend.